Clay, West Virginia, is tucked into the remote rolling hills of coal country. The nearest hospital is 50 miles away on these winding rural roads. And with a poverty rate approaching 30%, many here can barely afford the drive, let alone the care, like Carl and Elizabeth Walls.
If life and death depended on money, I'd just have to die.
You would be dead right now.
I'd have been dead right now.
Carl had a massive heart attack a little more than a month ago. First, a long ambulance ride and blood thinners at a rural hospital. Then an emergency helicopter medevac to Charleston.
They treated me with respect, with dignity, with every direction that you could ask. And in spite of me not having any money, I was treated as if I were a king, you know.
Most of their life savings went to paying for back surgery and other health issues Elizabeth had a few years back. She has diabetes and is legally blind.
Why won't you go to the doctor?
Because I can't pay for them. And I could go and I get bills and I can't pay those bills, so.
Thousands and thousands of dollars worth of bills come in, and what can you do about it?
Right. But so you'd rather not go to the doctor than to have a bill come that you can't pay?
Right.
Did you get in touch with her regarding that repeat on the mammo?
It is the dilemma Dr. Sarah Chenard faces every day.
Good, and then just give me a big old ah.
Trying to convince the uninsured not to wait for the heart attack, cancer diagnosis, or some other major problem to seek medical care.
We offer sliding fee payment scales. If they're at 100% federal poverty level or worse, then they owe us $5 only, and the rest of their care is waived. 35% of our patients are uninsured, and so we have to come up with ways to deliver health care at low cost and try to figure out what to do with their health care once they're outside of these walls.
The urgent focus here is preventive care, because it's the right medical approach and because Dr. Chenard and her colleagues know many of their poor and uninsured patients will ignore suggestions to see expensive specialists.
We see a large portion of diabetic, hypertensive, and hypercholesterolemic patients. Our hope is that we keep people away from needing expensive healthcare services. So our role in a rural setting is key. The question is, how do we keep paying for it? How do we keep giving discounted care? How do we afford to keep the doors open?
A big chunk of the clinic's budget comes from federal grants. And Dr. Chenard says she hasn't heard much talk during the reform debate in Washington about how to protect places like this in small-town America.
It'll be interesting to see what happens if they come up with universal coverage. What will our role as a federally qualified health center be? How is our role defined after that? I worry that we have patients here who will maybe not fall into some category and somehow slip through the cracks.
Carl and Elizabeth Walls share that concern. They sold 2 small businesses, watched the money go to health care bills, and now have thousands of dollars more because of Carl's heart attack.
You know, we have worked all of our life and tried, and we can't seem to get any programs that works for us.
It's not that the Walls or Dr. Chenard oppose the idea of universal coverage. To the contrary, it's just the sense that when there is talk of big change, people like them and places like this so often get left behind.